Well, good afternoon, everybody. Thank you so much for joining us today. We are excited here at Burrell to share more with you about our new community-wide suicide prevention project, ONE. And we're grateful for all the participants who are joining us, as well as the panelists and speakers for sharing their time. I'm Jana Gregg. I'm the Vice President of Marketing at Burrell. Also part of our Burrell team today, we have Brandon Greminger, who's our Vice President of Outpatient and Access Services, Rachel Hudson, who's the project director for our suicide prevention program, as well as Matt Lemon, our vice president of communications. Our CEO and president, CJ Davis, sends his regrets for being unable to join us today, but does join us today with this message.
Good afternoon. Thank you for joining us. My name is CJ Davis. I'm the CEO of Burrell Behavioral Health. What a wonderful day for us to talk about a really important topic, suicide. On behalf of the board of directors, our entire team, and more importantly, our community, thank you for taking the time out of your day to engage in this extremely important and critical and life-saving conversation. We know that suicide is the second leading cause of death for people between the ages of 18 and 34 years old, and that every 11 minutes, someone dies by suicide. Now, if you're calculating at home, that's 130 deaths per day. And not to mention the other age groups that are also suffering in silence and taking their life. This is a really important conversation, one that we want to engage our community on. We believe that our community, in partnership with Burrell Behavioral Health, we can do a better job. Those statistics are not acceptable to me, and they're certainly not acceptable to anybody that's joining us today. So I want you to really take something from this today, that you can be the one. You can be the one that saves a life. Thank you as we engage in our community partners, our stakeholders, individuals across our community in joining Burrell Behavioral Health. We are here for you, and we appreciate your time today. Thank you so much, and be well.
Good morning, everyone. Thank you again on behalf of Burrell, CJ, and our entire community for joining us here today for the ONE Summit. We have a full hour scheduled for you today, so I won't waste too much time here talking about this, but I definitely wanted to walk you through the program here over the next hour. We're going to have a community guest, Katie Towns, the director of the Springfield-Greene County Health Department, will join us, as well as the community story from Zach Troutman, who's the founder of Follow the Leader. After that, we will begin a panel discussion, specifically focusing on the ONE initiative and some of the early adopter organizations in our community that are committed to suicide prevention in their workplaces and in our community. So we'll share some best practices and some reasons that they think that this program is going to be right for them. Finally, we'll close out with a few action steps related to ONE and how you and perhaps your organization could be a part of this. So again, thank you for joining us. We hope you get a lot out of this. With ONE, it is our goal to create a networked, activated group of community members, all committed to the idea that suicide can be preventable. It's a responsibility of all of us to save a life, and we all have that ability. And through ONE, we hope that everyone can take that message and know that they have that ability to impact and to save lives. This program is possible because of not only one, but two suicide prevention grants that we have received from the Substance Abuse and Mental Health Services Administration. That's SAMHSA, the most recent one just recently awarded to us to take this effort into Northwest Arkansas, which we're very excited about. So again, this is a community effort. We thank CJ, Burrell leadership, and our board of directors for making this investment. But most of all, we appreciate every single one of you who have an interest and who are willing to step forward and find what it takes to be the one. CJ did share a few statistics in his welcome, but we do have a few more related to suicide loss. Globally, suicide is the second leading cause of death among individuals aged 15 to 29. And that's one life lost every 40 seconds globally. In the United States, that's one every 11 minutes. For each adult who dies by suicide, it's estimated that more than 20 others have attempted it. And then that rate continues to increase each year. Perhaps most impactful to a community mental health center like Burrell, more than half of those who die by suicide did not have a known mental health condition prior to their passing. So this often doesn't have a signal. This often is only uncovered through honest conversations and through the ability of people to have these conversations and talk to one another. So as a community mental health center, these statistics aren't acceptable, and is a huge reason why we have started this program and we are engaging our community in this conversation. To talk a little bit more about mental health, suicide prevention, and its effects on public health, I'm very pleased to welcome Katie Towns to join us today. She is the director of the Springfield Greene County Health Department. She was named the director of the department in July following 6 years as an assistant director. Previously, Katie served as public information administrator, a chronic disease administrator, and in a variety of other roles in the community promoting health and safety. Most recently, Katie has been instrumental in our regional response to COVID-19. She served as the operational lead for the health department and as a consultant to other departments across Missouri. I think we would all say that in terms of the public health response, Springfield has really led the way, not only regionally, but across our state. Katie also has a passion for improving mental health, and her role in coordinating a region-wide mental health needs assessment for our community resulted in additional resources and improved care for individuals with mental health concerns. That includes just one of the outcomes of that study was actually Burrell's Behavioral Crisis Center, which opened last year and has really emerged as a model throughout the state. Katie's joined us today to share a community perspective, her own perspective on suicide prevention and the importance of these conversations for Springfield and beyond. So Katie, thank you for joining us, and I'd like to turn it over to you for a few minutes.
Well, thank you, Matt, and I really appreciate that introduction, and to Burrell, to CJ and Adam and all of your leadership for bringing this program to our community. One of the things that I really appreciate most about Burrell is that you all continue to have tough conversations. Even though we've had a hard year and a half, you are bringing forward the issues that continue to sort of be things that we need to address and we can't shy away from. So I can't thank you enough for continuing this conversation and leading the way. Something I think that we started to see as COVID-19 unfolded more than a year and a half ago now was that the physical symptoms would be only a small part of the impact that it would leave on our community. But over this last year and a half, we've all lost, and we've lost a lot of things in terms of not just sort of fun things like vacations and sporting events and concerts and those sorts of things, but we've lost social interaction, and we've lost traditions, and we've lost some familiarity and comfort. And that really is, it's disruptive to our patterns of behavior, and it really has changed us completely. And it hasn't avoided a single person. So I think we all are collectively figuring out how to navigate these new norms that have been established by this virus. And one of the things that we unfortunately knew prior to COVID-19 was that Greene County has higher suicide rates, unfortunately, more than the state of Missouri and more than the national averages. And like Matt mentioned, we found that in a study that we had hoped to really dig in and start to work on some of the issues that were identified by that assessment when the pandemic hit. And so we know that those issues haven't gone away, and that we continue to struggle with our suicide rates. And so this venue, this program is going to be something that we will definitely utilize, and we will offer, and I think hopefully continue to normalize the idea of challenging old assumptions and really putting forth our best effort to save lives. That in public health is the number one thing that we aim to do, is to look at prevention measures that can go upstream and can offer solutions so that a crisis doesn't become a crisis. So I also wanted to just share that I myself, I've been fairly vocal about this, but mental health challenges have been a part of my life as well as my family. And throughout the pandemic, I have been very privileged, I feel, to have access to a great resource in my counselor that has provided me with a number of opportunities and coping mechanisms to help lead through the challenges that I face personally, as well as giving me tools to help lead an organization and in times a community in unknown territory. And I think what we want to continue to do is to acknowledge this for not only ourselves, but also our workplaces, where we spend a lot of time. And like I said before, we've all encountered new challenges and new ways of working, and that's disruptive. And so we all sort of have this ability to offer new ways of coping with the mental health challenges that come from the way that our world has been turned upside down, and that includes the workplace. I'm asked a lot of questions by workplace leaders on how they can, sort of navigate the next steps of workplace sort of rules that have been dictated from the virus. But I think one of the things that I would really encourage folks to consider is how they're also going to incorporate mental health strategies to help employees cope with the changes that they've all incurred throughout this pandemic. And a lot of those are sort of fringe. I mean, our life has been sort of intermixed with our work in a lot of ways. For example, I still have concerns about my kids at school. And so I'm sort of trying to do the best to be a mom and be an employee and navigate all that comes with that. So looking for ways that we can help support our employees as they navigate these challenges is in my mind paramount to how we continue to respond. I also just want to end with the fact that mental health does not necessarily, or our own struggles don't necessarily define us. And I think that this program, along with many of the other resources that Burrell provides, can offer us a way to learn to better cope and to see the hope that we have in the resources and in each other, and helping us to navigate this newfound territory together and in a more positive and constructive way. And so I offer that hopefully we will not only ourselves, but all those listening, and thank you for being engaged, but continue to pursue ways that we can all normalize this conversation and provide hope to yourself as well as your employees.
Katie, thank you so much for those words. And I know I speak on behalf of our whole organization when I say the value of having public health leaders like yourself and your predecessor, Clay, who prioritize mental health, know that it's an important part of the conversation and can focus on those upstream prevention methods and be a part of the conversation is so incredibly valuable. So thank you again for joining us.
Well, I'm honored to do it. Thank you, Matt.
Next, I would like to introduce our community speaker. This is Zach Troutman. He is the founder of Follow the Leader. And for anyone who's been a Burrell regular or been a regular watcher of the Be Well community over the last year and a half or so, has probably seen Zach either in one of his live segments or in one of our greatest hits reels. Zach was born and raised in Naples, Florida, and he graduated from Naples High School in 2005. He came to Springfield to attend Evangel University, where he played football and earned his bachelor's degree in family relations and earned a master's in counseling. Zach's been coaching and mentoring young people for the last 15 years of his life, and he's currently a mentor through Big Brothers Big Sisters and a new board member for Ozarks Literacy Council. Zach currently works as an assistant director for the renovations department at Arc of the Ozarks. But most importantly, and filling his role here today, Zach is an advocate for all things good through his work with Follow the Leader, which is an organization that focuses on motivation, leadership, and the fight for mental health. Zach's married to Samantha, and they have two sons, Zach Jr. and Zion. I'd like to welcome Zach Troutman in to share a few words and a message surrounding suicide prevention and mental health with you today. Thank you, Zach.
All right, thanks, Matt. I appreciate it, man. It's good to be back. First, I'd just like to thank you, Brandon, Rachel, and Jana, just for thinking of me, and allowing me this time to be able to not only share a story, but really share Adam's story. Um, and I think that's always important, when you experience suicide, whether it's a family member or a close friend. I think we're left to pick up the pieces, and I don't, I don't ever want the focus to be on, like, what is Zach doing. I like the focus to remain on Adam, just because he was such a special person, to me, and to all the ones that loved him. So again, thank you guys for allowing me to keep his name alive, and to be able to share his story, to hopefully impact people and understand that mental health is real. We have people dying all day, every day, and until we can normalize this conversation surrounding mental health and suicide, um, those numbers are going to continue to grow. And so for some of you that don't know, March 18th, 2015, just I got a call that you can never be prepared for. My best friend of 22 plus years had taken his life, and again, just coming from the inner city in South Florida, suicide is nothing that anyone talks about, especially men. It's just we never talked about it, and so I think initially, I was extremely shocked. Uh, I was hurt, but I went through so many things. But you gotta help the family prepare for the funeral. You got to do all these things, and you never have time to really feel or grieve. Um, and I myself had already been experiencing some darkness, but again, even having a master's degree in counseling, there still was a disconnect with my own mental health. And I guess I just felt like if I hid what I was going through and helped other people, I feel better that way. Um, and the guilt that I felt, I think initially the hardest thing was overcoming the guilt, just because I know that I have been sneaking off to see a counselor for some depression and not having enough courage to have one conversation with Adam about, hey, my life isn't all peachy, man. Like, your boy is struggling. Um, and then after the fact, after the funeral, um, and what people don't understand, when suicide happens, there's the police, the paramedics, they don't clean up the scene. That's to the family and friends. And so you want to talk about traumatic experiences, removing the clothes from their home. If it's a messy incident, you're responsible to clean all of that up. And so trying to navigate through all of that on top of, having a funeral and a life celebration, and then trying to figure out why, and then ultimately figuring out how can we prevent this from happening again? Because really the goal of Follow Leader is to prevent any family or any group of friends feeling what the Hall family felt that day and what our group of friends that we grew up hanging out with felt. Everyone feels guilty. Everyone feels like they can do more. But what action? We can have a conversation, but after the conversation, we have to take action. I have two small children that are 7 and 9, and the research is showing that kids are starting to think about suicide in second and third grade. And I don't know about you guys, but that's extremely heartbreaking. Like, kids should be kids. Our kids are being exposed and they're under attack from all these other things. And I think if we don't have those conversations, even with our young people, we end up speaking at their funerals. And I was 27 years old and I was speaking at my best friend's funeral, who is, for what we all thought, healthy. But the inside of him was not right. And there's nothing in the world that can prepare you to speak at your best friend's funeral. And I wasn't prepared, and it's still a challenge. It's still a battle, and it never gets easier. But I know that he's looking down and really proud of what the Springfield community has been able to do, and I've been able to partner with places like the Burrell to keep his name alive, but also to normalize these conversations, because I think that statistics have shown us that one conversation can keep someone alive. And had I had the courage then to have that conversation with Adam. I think that things could have been different, and I try to not go there too much, but I try to just press forward and have as many of those conversations as I can, because there's so many. I come into contact with so many young people from the ages of 7 to 18, and there's kids hurting at 7, and they're not able to articulate what that pain looks like. But these kids are telling me they don't want to live, and then there's kids at 18 that feel like they have no purpose. And so it's challenging, and I know that it's difficult, but we have conversations every day about sports, conversations surrounding sex, conversations surrounding politics, and so I definitely think that we can throw in mental health, because it shouldn't be a surprise, but just the last year with COVID, I know that I've seen an increase in drug overdoses and planned suicides. And these are people that I don't know personally, but that I'm connected to, because things are being shared in my inbox and on my social media. And Adam's death it for sure represents the greatest tragedy of my life, because he was young and he was just an awesome person. I love talking about him because I don't have to lie, I don't have to fabricate anything, because he was the most genuine soul. But man, he was hurting so much on the inside. And when I think, the more I study, the more I read, the more I listen to people like you guys, it definitely makes me want to help and do everything I can. And through my work with Follow Leader, I'm just desperate to be in any area where people are hurting and want to get help and want to be better. And so I just continue to fight against mental health and to continue to normalize the conversation, because I think it's neat. The One Initiative, if you haven't taken a look at the pledge, I suggest that you do so, because it's awesome. There's some accountability there. That it's a commitment to just making your community just better and healthier. And I think that there's a special bond when you can sit with a group of people and really be vulnerable and transparent. There's a lot of growth there. And then most importantly, there's a lot of healing. And that's what I realized is a lot of people will come to you and think you're expert, but sometimes it's like just being a decent person and asking that tough question. I'd rather ask a hard question than have to speak at a funeral, for sure. And so I know Adam's death and suicide, it was something I never talked about. 7 years ago, you could never get me to sit down and talk about that. Probably mental health and suicide is probably what I talk about most after my family. And it's led me to become a QPR instructor. Shout out to Rachel and Burrell just for thinking of me enough to want to put me in a position like that to be able to help even more people. And if you haven't taken QPR, I definitely suggest doing so. That class and just going through it and studying all the material, it's been vital to just my growth, to be able to connect people to other resources out in the community, because some people are just afraid to even say that they don't have it figured out. I think that in 2021, we live in a society where you typically only see highlight reels, whether it's social media, YouTube, the internet, whatever. But there's a lot of people that are struggling, and trying to keep up with the Joneses is hurting a lot of people. And so for me to be a voice for the voiceless and to speak up for all those people that were silently hurting, like my buddy Adam, the day that he passed away, him and I were on the phone 4 different times that day. And it doesn't get any easier to talk about that day, just because I don't know. There was nothing, couldn't really hear anything. I try to, I hear his voice from time to time. I try to think like, dang, what was going on? But I know that QPR has really helped me kind of hone in on some of those signs and just being aware. I wish I would have had QPR 6 years ago. I promise it would have made a difference because we were on the phone. And, when you lose someone that close to you, Adam was by far my best friend, but the closest person to me. And so it left a big hole in my heart. And I've literally been trying to fill that void for the last 6 years. And it's been awesome to be on this journey to help other families, help other people. And so I won't stop until they have me 6 feet under. I'm not going to stop going into spaces and creating these safe spaces within other spaces to continue to have these conversations, because again, it just takes one conversation. And I'm just thankful. Burrell, Matt, Brandon, Jana, Rachel, thank you guys so much for allowing me to stop in and just share my heart and again, keep Adam's name alive.
Zach, thank you so much for joining us. And I was struck by something you said. You said you wish you'd had the courage to speak to Adam, but I don't think courage is the issue. You've shown plenty here today, and with all you've done in the past 6 years for individuals in our community. I think the issue is empowerment and vocabulary, right? And that's exactly what we're here doing today. That's what we're trying to do with the One program and get that empowerment and vocabulary into people's lives so that they can make a difference. It's excruciating to hear what you went through and what you had to do for your friend, but we so appreciate you sharing this message for your advocacy and continued advocacy in the community and for being a part of this.
Thanks, man. I appreciate y'all.
That now brings us to just a little bit more conversation specifically about One, which Zach very graciously went into some information about QPR training. I mean, question, persuade, refer, which is sort of a centerpiece of what we're trying to do with One and bring that training to more people in the community and organizations in the community. To discuss how we're going to do this and why organizations are interested in joining this movement, we have a few representatives of early adopter organizations here in Springfield and Southwest Missouri particularly to talk about their programs, organizations, and what they hope to achieve with this. I would like to introduce our panelists, and as I get to you, if you want to go camera on, we can get to the roundtable portion of this. Our first panelist is Sarah Lyons. She's the CSBG project coordinator with OCAC. Sarah has 19 years of nonprofit leadership experience, and the last 5 has been spent at the Ozarks Area Community Action Corporation, or OCAC. She currently holds the position of project coordinator and oversees a variety of existing projects in OCAC's 10-county service area, as well as exploring opportunities for expansion. She's certified in both youth and adult mental health first aid, as well as QPR, and is a certified instructor in the latter 2. Outside of her work for OCAC, Sarah also provides consulting and content creation services to nonprofit clients and serves on advisory boards for several community organizations. In her spare time, Sarah enjoys exploring the great outdoors with her fiance and their pack of misfit rescue dogs. Second member of our panel is Ed Durr. He is the chair of the Suicide Prevention Coalition of the Ozarks. Ed's a licensed professional counselor and also a nationally certified counselor. Ed's worked as a professional mental health counselor for 29 years. He's a disability resource counselor in the Disability Support Services Office at Ozarks Technical Community College and also meets clients in private practice. Ed is chair of the Suicide Prevention Coalition of the Ozarks, and he and his wife co-facilitate a family support group for the National Alliance on Mental Illness, or NAMI. Ed has facilitated Muscular Dystrophy Association client, family, and caregiver support groups, and he's been married to his wife for 31 years and has 2 adult sons. Thanks for joining us, Ed. Our third panelist is Keith Boatwright. He's the Director of Human Resources and Risk Management for Springfield Remanufacturing Corporation, SRC Holdings. Keith has over 20 years of human resources experience, spanning family and private companies, all the way to Fortune Enterprises. Keith joined SRC Holdings Corporation in 2010 as Director of Human Resources. Acknowledges the top 25 best small company in America by Forbes. SRC is an employee-owned remanufacturer directly servicing original equipment manufacturers. They're known worldwide for open culture and the great game of business, and that focuses on transparency, integrity, and business literacy. Last but not least, we have Rachel Hudson, who is the project director for Burrell's One program. Rachel's a licensed master social worker and has been with the behavioral health field for 18 years, 17 of those years with Burrell Behavioral Health. She currently holds the position of project director for the Emergency Response to Suicide Prevention Grant, which helped fund one that Burrell was awarded through SAMHSA in 2020 in response to the COVID-19 pandemic. Alongside Dr. Brandon Greminger, Rachel has a significant role in the development and implementation of One. In addition to her work at Burrell, Rachel is a per-course instructor at Missouri State University with the College of Health and Human Services Social Work Department. Rachel is also pursuing her LCSW and will be starting her clinical hours next month here at Burrell, in addition to her role with One. So thank you, all four of you, for joining us. And I think I'll start with Rachel here. And I'd like Rachel to frame One, which stands for Our Networks Engaged, the reasons Burrell decided to launch a community-focused suicide prevention program. And what does this provide to our community that might have been missing before?
So One's mission is to collaborate with businesses and individuals within our Missouri and Arkansas communities to promote suicide prevention through education and awareness. One of those educational pieces would be the QPR training. And so in 2019, there were approximately 48,000 deaths in the US to suicide. And something that stands out to me, that number is extremely tragic. And for every one of those people that have died, up to 25 people attempted but survived and are still here. And so that means 1.4 million people a year. That's a lot of people that need our hope and assistance to stay alive. So great things have been happening and are happening in our communities. And so this initiative really provides an opportunity for all of us to come together and collaboratively make these efforts known to our communities and to engage in conversations, program development, and just really be a team with each other. And Thomas Joyner is an American psychologist and is considered the leading expert on suicide. And he identifies feelings of isolation and loneliness being a contributing factor to suicide. And so not only can we not do this alone as individuals, but we cannot do this alone as organizations. We all need each other. And so obviously, as one of the largest, Burrell is one of the largest, one of the largest behavioral health organizations in the country, it only makes sense that we lead by example here. So.
Rachel, Burrell was the first signer of the One pledge. So can you speak really briefly about what we're actually going to implement for our 1,800 plus employees as well?
Sure. So we have two goals. One of those goals includes providing QPR, which is question, persuade, refer training to all of our staff. That would be frontline staff, non-clinical staff, clinical staff. Every single employee at Burrell will receive this training. And then our second goal is to provide QPR trainings to our community partners. And so these would be completely free of charge. And we would honestly, if people just reach out and tell us that that's what they want, we will make that happen. So we are really excited to have the opportunity to be able to do this.
Thank you, Rachel. Next question is for Ed. Ed, you're with the Suicide Prevention Coalition of the Ozarks. And in the past, Springfield's been described as programs rich, but systems poor. So what we really want to avoid with something like this is having a community program like One that's redundant to other things that are already happening. Obviously, the Prevention Coalition has signed on to participate in One, which I think signals that this isn't redundant. So please tell me a little bit about what the coalition does and how adopting the pledge for One will further enhance the work that you're doing.
Yeah, absolutely. Well, just to start off, I mean, everybody can play a role in this process. I mean, everybody can play a role in suicide prevention. It's a very difficult conversation. It's not a fun conversation to have. And however, what we're finding is that since it's not a popular topic, it's not a fun topic, we don't talk about it. So there's a real quietness that comes over a lot of us when that topic comes up. It's even hard for us to mouth the word suicide for a lot of us. Okay. The CDC calls suicide a public health concern. And so I know COVID has been front and center here the last couple of years, year and a half. However, suicide is still a concern in our community. So by having this, the one initiative, it allows us to have these conversations and these trainings to occur. So in this situation on our Ozarks, I mean, it's really a benefit. It's really important to cast this net very wide. So really more is better. More of us that take on this opportunity, the better it is. So so our systems, there's not a concern of having too many tackle this. It is that type of situation. So with the Suicide Prevention Coalition, our mission is to decrease the number of suicides through educating the public, early detection, promoting and identifying signs and symptoms, and having these conversation starters occur. And we've been able to host QPR trainings that we've talked a little bit about, and also promote other trainings and other programs that have occurred in our community, like the identifying the signs of suicide, mental health first aid, and just promoting individual wellness in our community. We just want to also help reduce the stigma associated revolving around suicide and mental health, mental sickness. So that stigma or the perception surrounding taking care of ourselves can be very paralyzing in a sense. And so that really does work against us, or it can anyway, from having these really deep-rooted conversations, but also the action that Zach spoke about, having some traction and having some action to do things for others, for ourselves, for our communities. And that's what the coalition is attempting to do. Suicide is a very large swath of population concern, right? We have young, we have old, we have all genders, we have all races, we have, everybody can be at risk at some point. And with that, we want to, in our coalition, with our signing on to the One Initiative, I mean, our coalition cannot do it ourselves. That's why it's good to cast this net pretty large, but we're going to be identifying some populations. Maybe it's bullying with school-age children, for an example, or maybe it is a targeted population of our senior citizen population. We're also very much at risk for suicide, but our coalition is going to select a couple of populations to hone in on and see what we can do to help promote, again, more education and more conversation and more action to save lives.
It's great. Thank you. And I love that sentiment that sometimes more is more, right? You can't have too many people talking about this and creating action steps around this. So thank you to you and then the work that the coalition is doing. Next, I'd like to address a question to Keith Boatwright with SRC Holdings. As one of Springfield's largest manufacturing employers, Keith, can you tell us a little bit more about the mental health needs of your workforce, particularly in the light of the last 18 months and all that's come with COVID? And then how do you anticipate training and education around suicide prevention to help not only your workforce, but your business?
Absolutely, Matt, and thank you. Hello, everybody, and thank you for having me. Well, I don't think I'm telling anybody here something they don't know about the stresses of COVID. What I may be able to add are pieces of data and some observations that are really impacting us going forward. When I look at, for example, our employee assistance program, so I look at that front. So first off, utilization jumped during COVID. No big surprise there. However, the top presenting concerns changed. So EAP calls transition from legal anxiety and grief and are now driven by partner couple issues, no doubt from staying at home, depression, stress. We saw how expanding our referral sources through education and marketing helped drive a lot higher EAP access, which was fantastic to see. We needed desperately the advocacy of more supervisors and our wellness committee champions. Telehealth works similarly in that we had to double down on marketing efforts, and mental health therapy is also part of our telehealth offering. So why are these alternatives so valuable to us, and what does it tell us about mental health needs in our workforce? Well, our healthcare data illustrates that the inpatient and outpatient care plummeted. You know, it's still staggeringly low compared to 2019 trends. SRC had points where inpatient days dropped over 60%. Outpatient care was almost completely cut off. When you talk about mental health, our inpatient admissions dropped to 0 in late 2020. And that was while we were literally approaching the peak of the pandemic. So our employees, their spouses and children just didn't get the care they needed from the traditional sources. So we got similar feedback from our employee wellness committee. So we know that a lot of our associates have yet to rekindle care from an outpatient evaluation or a primary care physician. So for us, the needs of the workforce really involve educating and inspiring our leaders and coworkers to be those referring sources. You know, so some things remain the same. We continue to break down barriers to care, right? COVID is now a monstrous barrier to care. You know, I think Jack Stack, our CEO, said, you know, it's vital to have a stable and safe place to work. With the one initiative, we can now improve our mental health programs and integrate them into our corporate-wide safety and health programs. So much of our key impact will be accomplished by really connecting boots on the ground help. We know there's been a decline of in-person care, and it's not likely going to be changing anytime soon with what's going on. So frankly, we've got to do a lot more going forward to provide education and training around mental health, around suicide prevention, so that our employee owners can not only intervene and help, but they can refer themselves, their family, their coworkers, their friends to the care that they need.
Thank you, Keith. And I think it's a great reminder that there's so much that goes into helping a workforce with both their primary and their mental health. And thank you for making this investment in the team at SRC and the vision. And we're happy to be here to help support that. Next question is for Sarah Lyons with OCAC. Similar to Burrell, I feel like we're sort of kindred spirits in that we're nonprofits with missions for helping people and improving lives and making things better. But I know it's a continual conversation we have in our own organization but first we have to take care of ourselves, right? We can't help other people if our teams are also struggling. So I'd like you to talk just a little bit about how one will help OCAC further your mission and better serve your employees and communities.
Thank you for the opportunity to be here and talk about this. It's very important right now with COVID. We've definitely seen a lot of increase in mental health concerns amongst employees and the public, and I would include myself in that. One is going to help OCAC further our mission by providing ongoing opportunities for conversations and community building. Simply encouraging those employees to get help is an empty gesture. There has to be some sort of cultural shift surrounding mental health issues. And one is helping OCAC create that shift by fostering a workplace environment that encourages communication, belonging, connectedness, and respect. The one initiative not only helps to prevent suicide, but also burnout and compassion fatigue. Those are big areas that we see all of the time, but especially now. This helps us retain those talented and skilled team members in roles necessary for serving our community. We're creating a more informed, compassionate workforce where our team members know they're valued and supported. And we're doing that by training all staff members in QPR that will help not only internally, but also when they're serving the community. And we're looking at enacting policy changes that promote mental wellness and break down the stigma surrounding mental health issues.
Thank you so much, Sarah. We've heard multiple of the folks on our panel talk about QPR, and when we know that stands for question, persuade, refer. I would like to invite Rachel back in now to talk just a little bit about why this is such a key component of one, and how this is an effective method of training people for having conversations about suicide and suicide prevention, and how it might differ from other programs that they've heard of, like maybe a mental health first aid or something like so. Just share a little bit more about QPR, Rachel.
Sure. So the Q in QPR stands for question, and that's where we are actually asking the question about suicide. And I also frame it as a conversation, because once we ask that question, we want to be able to engage with that individual and be able to talk openly and allow them to talk openly. So this really gets people comfortable with saying the word suicide and really getting them acclimated to that process. The P stands for persuade. We're persuading them to actually to live. We're persuading them to trust us. We're persuading them to open up. And those attending the training learn different ways of being able to do that, whether that's giving someone your undivided attention, reminding them of why they're here and how to provide hope. And then the R stands for refer. And that's a piece that a lot of times can be overwhelming because we might not know where to send somebody or what information to give them. So the training equips individuals to know what resources are available in their specific community and the best ways to access those. One thing I absolutely love about QPR is it can be done in 1 hour. So it could be done over a lunch break. It's very quick. It's very basic introductory information that anybody can attend and practice and implement the tools learned. Mental health first aid is also something we actually are able to assist with as well. That is a more in-depth full day training that really looks at the broad scope of mental health and different mental health crises that may come up. So QPR is more suicide prevention focused, whereas mental health first aid is more broad and encompasses a lot of different aspects of mental health. So.
Thank you. That's good context, and I think it's definitely a plus of the program to know that you can spend an hour and walk away after an hour with again that motivation, empowerment, and vocabulary to help make a difference. So appreciate you putting a little bit of definition to that. I'd like to invite anyone from the panel if there's been anything that's sparked a thought both about either one as a program or something related to your individual organization that you hope to accomplish that you'd like to leave our community with. We have just a couple minutes left in the panel time.
This is Keith. I'd be happy to jump in. I think our launching plan on this is obviously to get a train-of-trainer session conducted, and then to have that person interact with our wellness committees and cascade that training to the respective divisions, and then they can be those respective champions. And so this is a matter of really cascading it out. I think in formalizing this for our supervisors, because they're really the ones that have so much responsibility. I like how you frame the vocabulary, because they have so many responsibilities, but yet they need that tool set. They need something they can grab out of that tool bag and use immediately. And so I think this is going to provide that to them as well. And again, manufacturing environment, love that hour. Love the ability to have something really impactful that we can have contained amount of time. I think what's going to be interesting is perhaps a stretch is we do a ton of first aid and CPR training, way beyond, just normal responder type folks. We've been looking for a long time at integrating mental health first aid, but it has proven to be too long. The ability now to look at that program and infuse QPR with that and have that as just a regular part of our training programs, again, is going to disseminate that information out. And so we're looking forward to kind of figuring that out. And of course, I'd be remiss if I didn't mention all this is surrounded by marketing materials, social media awareness, and really we've got people in all spectrums. So it's trying to meet people where they are with this information. And I think we have plenty of people that are empathetic, but I think it's connecting that empathy to action, as I heard recently. And I think this is a great program to do that. And I'm really thankful for y'all bringing it on.
Thank you, Keith.
I would kind of echo what Keith said, and I would encourage anybody to find a way to take QPR training. It's just 1 hour of your time, and you heard repeatedly how difficult it can be to talk about suicide, but that training will give you the skills to know how to ask in a very specific way and how to then move forward if someone is considering suicide. So it's necessary, I feel like, to be able to ask that question in a very specific way to get an answer and then save a life.
Absolutely. Thank you, Sarah. And I think that's a really good segue to our final presenter, and I'm going to invite Dr. Brandon Greminger with Burrell on. We've heard a lot about how this will help a number of organizations here, but there's also an individual component to this, and we want to invite anyone who may feel a need and a calling to engage in this and have this motivation and vocabulary to take the one pledge. So Brandon, before I get to you, I want to thank all of our panelists, Keith, Rachel, Sarah, and Ed for being here, Zach, Katie for representing. I'll let you talk a little bit about the tactical and next steps people can take with one, and then we'll send it back to Jana to close this out for the hour. Brandon, take it away.
Thank you, Matt. And yes, thank you to everyone, to Katie, to Zach, to Keith, Ed, Sarah, Rachel, Matt, Jana, all of our community partners for coming together today for the inaugural One Community Summit. So I want to point out this is the inaugural summit. You know, what this represents, this is a group of real members in our community that have come together today to lock arms, have an honest conversation about suicide. So this is a heavy topic, but a pretty exciting moment, if I do say so myself. So I'm excited to share a little bit about how to get engaged and do a little bit of a recap on one. So as Matt said, I'm Brandon Greminger. I'm our Vice President of Outpatient and Access Services here at Burrell Behavioral Health. One stands for our networks engaged. So if at this point you are wondering, how do I get involved? There are two opportunities. So businesses can take the organizational pledge and individuals can take the individual pledge. Taking this pledge, to reiterate a few points that our panel members shared earlier, this is a call to take real action. So this is more than just signing a piece of paper, but as several of our guests mentioned today, we've been talking about hope. We know that creating hope is the first step towards meaningful change. And eventually towards resilience. So we know hope is the first step towards another word that we heard a few times today, towards healing. So with one, Burrell's plan here is to support those that take the pledge in taking simple but active steps towards suicide prevention. So I'm going to talk about how simple that can be. For businesses, this is as easy as 4, 3, 2, 1. So businesses that pledge to be part of the One Initiative will work with Burrell experts to learn about what you heard about earlier today. So how to implement a suicide prevention project within their workplace. So what we ask those businesses to do then is to produce 4 instances of content. So to get the word out on how that project is going so that we can celebrate some of those successes and have more opportunities for honest conversations. There are up to 3 workplace champions that will drive any of these projects forward that work with myself and Rachel Hudson on how to learn about implementation and success on a project in their system, specifically one that's about suicide prevention. We'll help set 2 goals so that we can measure whether meaningful change is taking place. So, this is one of the last things that we want to send out training on, and it just goes on a shelf and doesn't get used. But we want to set up some implementation that allows these changes really to be sustainable in the system. I think we heard Keith talk earlier about we really want to train trainers so that we can keep training new workforce as they come to join us, and that everyone has an opportunity to talk about suicide prevention when they join our team. And then 1, to maintain 1 commitment to program development towards suicide prevention. And so when we say maintaining 1 commitment, this is the launch of 1, and we intend 1 to be a community movement that's around forever. So when the first project's done, we'll be working with our community partners on what's the next project. When we're in year 2, what's the next big thing that we want to do for our community to save lives? And then the second way to get involved is as an individual. So individuals that pledge, They're pledging to promise to take specific steps to develop and spread awareness in our communities. So this also we've made as simple as 4, 3, 2, 1. So we want individuals to have 4 honest conversations about suicide after they've taken the pledge, to share 3 resources about suicide prevention, whether that's through social media or other avenues, to participate in 2 trainings and to take 2 surveys. So just another engagement opportunity. When you take the pledge as an individual, you get an invitation to our virtual community where we will post numerous opportunities to engage in trainings. And as Rachel mentioned earlier, we right now have some opportunities to get QPR training and have been doing some hosting on various other webinars and things that we can do as individuals if we're following our virtual community on how to get engaged. And then again, the surveys, just to give ourselves some feedback on what did I know before, what do I know now, and how can I use this information to make meaningful change in our communities? So to put this individual pledge in perspective, if 25 people take the pledge, that means 100 new conversations about suicide take place and 75 different resource sharing opportunities take place. So that's 175 opportunities to possibly get somebody help or get the word out that might not have happened before. That might be 175 lives saved. If we up that a little bit, if you've got the calculator out, if 100 people take the pledge and you run those numbers, that's 700 engagement opportunities to interact with somebody that we care about, or for them to get access to a resource that might lead them towards getting help. So the spread and the reach of this, Ed mentioned earlier, casting a wide net, even though it's as simple as 4, 3, 2, 1, as soon as you start to do the math, the more people that join us in the movement, the number that we can reach becomes really big, really fast. And the impact of this can become really big, really fast. So, to recap on a couple of points, talking about suicide, we know it's not a skill that everybody's born with. And Sarah reiterated a really great point earlier. So if we want to see these statistics change that we've talked about since the beginning of our summit that are unacceptable, we need a cultural shift. So we need a cultural shift in our community that can start in the workplace, that can start in our homes. And one of our goals is to connect directly with our community. So with our community partners, with our community members, to provide this training on suicide prevention skills, access to these resources, and help everyone in our community become a better therapeutic helper. So to reiterate some other points that we've heard multiple times today, it's part of our mission, not just as Burrell, not just as a one member, but as a community member, to try to increase hope and decrease stigma around suicide and around mental health. So it's part of our mission to heal. And so we really do believe that if every person that takes this pledge, every person has the potential to be courageous in this space. It's a really hard thing to talk about, but as a community, if we're able to become more comfortable and confident, and to some of the points earlier, I think that Matt mentioned, if we really, lean into feeling empowered and empower one another to talk about suicide openly, we're going to increase the odds of identifying these signs earlier and provide support to the ones that we love, potentially before it's too late. So one is a community movement to save lives. And going full circle back to the beginning with Matt and Jana's introduction, all it takes is one person to save a life. We believe that. And we believe everyone here today can be the one. So if you want to join us and take the pledge as an individual, if you're a member of a business that wants to take the pledge, please visit us at burrellcenter.com/one. To send a message to the one team so we can reach out and see how we can get started together. So I want to thank again everyone today, and Jana, I will pass the microphone back to you.
Thank you so much, Brandon, and just reiterating the thank you to all of you for joining us today, and to our participants. We do want to open up to questions. We know we're right at 1 o'clock and want to be mindful of your time. One question that's in the chat, probably throw it to you, Brandon or Rachel. Someone's asking, how do they go about getting in touch with you so you can come present this to their organization or networking group?
I'll jump in, and then Rachel, if you don't mind filling in any gaps that I missed, but if you'll join us at our website there, so at burrellcenter.com/1, there's an opportunity to interact with, to pull some of the resources, but also to reach out to the One team. Another direct line in is that email address you see there on the screen, one@burrellcenter.com. If you'll shoot a message to us there at that group email address, we will reach out and get in touch about how we can get a project started.
Thank you, Brandon. Not seeing any other questions, so I think we'll go ahead and conclude. If you think of any other questions, if you would like to learn more about this initiative, please reach out to us at one@burrellcenter.com. You can also get in touch with us from our website, burrellcenter.com/1. Thank you, everybody. Thank you for joining us today.